All right, apologies for our technical difficulties, but we are back and we are ready to get started with our presentation. We will get started right now, and I'll turn it over to our wonderful esteemed EMS panel.
Good night, everyone. Our topic for tonight is enhancing healthcare access, the vital role of pre-hospital care in the Bahamas. What is EMS? EMS plays a vital role in the healthcare system. EMS is a system that encompasses first responders, firefighters, police officers, EMTs, advanced EMTs, paramedics, critical care paramedics, and so on, and also dispatchers. EMS is predominantly, encompasses pre-hospital care technicians like EMTs, advanced EMTs, and paramedics, as I said before. We normally work on an ambulance where we provide pre-hospital care on CMTs, which is care outside of the clinical setting, and we focus more on pre-hospital care, such as assessing patients, triaging patients when we encounter them, also stabilizing, starting treatment, also communicating with the receiving facility, as well as speaking to our medical control, and so on. Roles of EMS personnel. As an EMT, our roles range from, like I said earlier, first responders, EMDs, also known as emergency medical dispatchers, EMTs, advanced EMTs, paramedics, and so on. Our primary goal as as professionals is to do no harm. We arrive on scene, we evaluate, we assess, we take information, we come up with a treatment plan, and then we also communicate that treatment plan, or better yet, speak with the receiving facility to see how best we can come up with a plan for our patient.
Okay. Okay, so now we're going to talk about why we believe that EMS is important. So healthcare is basically a chain, and we do believe that we are an important link in that chain. So from the time that your emergency starts, we are usually the first personnel that you come in contact with on scene, being able to provide that immediate care, starting from when we arrive, and we're able to continue that care from scene to the ambulance all the way to the hospital. Without that chain, without that link in the chain right there, that can cause a lot of delays in healthcare, which can cause deterioration of our patients as well. We're able to start that care, be able to call the hospital, let them know what we're coming in with, what we're dealing with, what we've done for the patient so far, and then we can just carry it over to our physicians and nurses who are able to continue that advancement of care. That is why I believe that EMS is very important. Without EMS, there would be a grave delay in patient care, and we do not want that for our patients. Next slide.
Sorry.
That's okay.
There you go.
Levels of pre-hospital care. Next slide, please. We have an emergency medical dispatcher, or an EMD. This person is the person that you would speak to on the phone when you call for emergency services. When you call an emergency medical dispatcher, you are to give them all appropriate details about the situation at hand so that they can relay this information to the crew in order for them to respond effectively. Emergency medical dispatchers can also provide pre-arrival instructions like how to do CPR or bleeding control based on the details you provide to them. An emergency medical responder, an EMR, also known as a first responder, they are trained in basic first aid. They are allowed to perform such interventions with minimal equipment like an AED, which is found at business places and schools.
Next slide, please. Thank you.
An emergency medical technician, or an EMT, This is one of the most common levels found in EMS, the backbone of EMS. EMTs are certified to provide basic interventions and transportation. EMTs in the Bahamas are certified by the National Registry of EMTs and are licensed by the HPC. And in order to attain higher level of training in EMS, you would have to at least have an EMT certification. An advanced EMT, also known as an AEMT, they are trained to perform some advanced interventions, but also some basic interventions. So they are more so the middleman in EMS. They are also allowed to assist paramedics with some advanced interventions. A paramedic is the highest EMS skill level. They go through extensive training in order to provide critical care to patients. They are able to do more advanced interventions than all the other levels of EMS. Additional levels of pre-hospital care would be medical directional control and or registered nurses. Medical control or medical direction is normally a physician that oversees the EMS system, and registered nurses, in order for them to work on the ambulance, they would have to obtain an NREMT certification, and then in the Bahamas, an HPC license in order to function as an EMT.
All right.
Scope of practice. Okay. An EMR scope. So as mentioned before, an EMR is basically a first responder. So they are trained to recognize the severity of a situation and to call for a higher level of care, that is an EMT or a paramedic that are on board an ambulance. An EMT scope. An EMT is trained in basic life support. They only do basic interventions. They conduct patient assessment. They do CPR, provide bleeding control, bandaging and splinting. They administer oxygen. They can also assist patients with taking certain medications like an EpiPen or an asthma pump. EMTs are also trained to safely extricate patients from hazardous situations and transport them to medical facilities. It is also extremely important to note that the EMTs at Doctors Hospital have an advanced scope under medical control. So we function as AEMTs do on an international standard. An AEMT scope, as mentioned before, they are the middleman, so they are trained to do basic and some advanced interventions, such as starting IVs, fluid resuscitation, giving certain medications like glucose, and also providing advanced airway management. They're also allowed to assist paramedics in certain procedures. A paramedic scope. A paramedic has the most advanced level of pre-hospital care training. They are allowed to do advanced airway management like intubations. They can interpret ECGs. They also administer a wide range of medications and are also able to initiate IV therapy.
All right.
EMS in the Bahamas. EMS in the Bahamas is a system that is governed and overseen by the Ministry of Health. That means that whether you are a private entity or a governmental agency, you are overseen by the Ministry of Health. They basically make sure that what is done and happening is actually standardized for the Bahamas. Now, because the Bahamas is 700 island keys, and out of those 730 of which are inhabited, the bulk of EMS agencies are located within Grand Bahama and New Providence. Now, as for training, all EMTs, all of us are internationally trained and recognized as such by taking nationally registered examinations, and we are all licensed under the Health Professional Council, HPC, so that we can perform and practice as EMTs.
All right, so. So next up, we're gonna talk about the benefits inside EMS. So the first two benefits that go together is community impact and critical care. Like I said earlier, we're really the first people that you meet whenever emergency happens. We're able to provide that critical care and stabilization from the time that we arrive on scene, and we're able to continue that care as we continue into the ambulance and into the hospital. So we are also able to support our vulnerable populations. That would include our elderly patients, our chronically ill patients, and our mentally distressed patients. We all know that with our elderly patients, as they get older, they lose a lot of their independence, like mobility, their eyesight, their hearing, and sometimes they may even have cognitive defects as well. So with these patients, we try to take our time with them, knowing that they may take a little time on scene versus our normal day-to-day patients that we may come in contact with. And then when it comes to our chronically ill patients, they are the best teachers of their own conditions. Even though we are trained to understand and treat what they have going on, they deal with their conditions on a daily basis, day-to-day. So it's just always best that we do listen to them and they are able to help us to do our job more effectively. They may appear sometimes agitated, or they may be overwhelmed because they're dealing with this day in and day out. So we know that we have to take a lot more patience with them and just provide that supportive atmosphere for them so that we can be able to get our job done, but also care for our patients' mental health as well. When it comes to our mentally distressed patients, sometimes they may be very fearful of us. They may think that we're here to cause them harm. So it takes us a while where we need to build that trust with these patients, and we need to build that very supportive atmosphere with them, letting them know that we are here for them and it's not in a harmful way. We are here to help them and do what we can for them so that they can get the best treatment possible. So next up, we want to talk about some challenges and opportunities in EMS. Some of the challenges that we want to talk about in EMS, two of the biggest ones would be resource limitations and geographical obstacles. We all know that in the Bahamas, we have a lot of resource limitations, such as maybe sometimes we don't have enough ambulances, we're maybe understaffed at times, we don't have enough medical equipment. As much as we really love to do our job, it can hinder our job and our standard of care with our patients at times. So there's a lot of times where we really just have to be innovative and try to do what's best for our patients with what we have. Another one would be geographical obstacles. We do have about 700 islands and keys in the Bahamas. About 30 of those islands are inhabited, and within those 30 islands, our two biggest predominant islands, which would be New Providence and Grand Bahama, are the ones that mainly have the hospitals and the more developed EMS system. But then what about the smaller islands like San Salvador and Ragged Island and Abaco that don't really have developed, or they have volunteer EMS systems? They're having to lean more on their community to be able to do volunteer work. They're having to use their private vehicles to be able to get people to medical facilities. They have clinics, but the clinics are limited as well because they have understaffed. They have a lot of understaff in the clinic. So a lot of people are playing multiple roles in the clinic, and it's not able to operate 24/7 because there are not a lot of people. They are human at the end of the day, so they can't be on shift 24/7. But that right there can cause a lot of delay in EMS care because they're having to be airlifted out to Nassau, and the time between when the accident or whatever their emergency is occurs versus the time that they get to Nassau, they can sometimes be in a much poorer state than they initially was when we got there. However, we don't want to just dwell on the challenges in EMS. We also want to talk about the opportunities in EMS for growth. So improved coordination. We are trying to do this where we have better communication between us, our healthcare facilities, such as the hospitals or the outer healthcare facilities, where we're able to have better communication so that whenever we start our patient care, we try to start up our patient care very strong. So whenever we start, we try to keep that patient care going, and we're able to communicate with the hospital and let them know what has already been done for this patient, what has occurred with this patient, so that when we get there, they have a team of doctors and nurses or whoever specialists that the patient may need to start care from where we are. So that means that patient care doesn't have to start from scratch. It can just continue on and it never stops. Another one is advancement in technology. Every day, you know that technology advances, and so does patient care. Over the last few months, Doctors Hospital has been advancing our technologies with newer monitors, We have more ambulances that we just recently got, and we have more medical equipment that our ambulance are stocked with so that we are able to do a better variety of patient care and we're able to do extensive interventions. Because sometimes our interventions can be anywhere from like splitting an ankle, or it can be us doing resuscitation efforts in the back of the unit. But now that we're getting more of these equipments for advanced care, we're able to do a lot more for our patients so that when they do get to that definitive care, they are usually better, have a better outcome when they get there. Next slide. All right, so next we're going to talk about how can we assist EMS, and we're going to start with Justin.
Oh, remember that when we arrive, please stay calm and clear. In other words, when we arrive on scene, it should be a straight line from well, for us, straight to the patient, which means that clearing like creating a pathway so that we can get to the patient. That means we're moving vehicles out of the driveway, moving furnitures if they can move, putting up animals like dogs, because yes, we all know that everyone and their mother has a dog. And yes, most house dogs are friendly, right? They're friendly to you, not to us, because to them we are strangers. And to them, here we come touching their master. So they go in attack mode, they bark, they bite, and all dogs have teeth. And if they have teeth, they will bite. So please, if you can assist us by putting up your the pets, moving vehicles out of the driveway, moving furnitures out of the way, so that we can have a clear line from the ambulance straight to the patient so that we can start care. Because the faster we start care, the faster we're able to assess, do what we have to do, and then take them to the hospital where they can receive definitive care, because that's the goal. And also follow instructions. When we arrive on scene, if we ask you to help us do something or to like get the patient's medications or whatever have you, assist us in getting that, because that right there is a very important key information for us and for the hospital, because we don't want to take a patient who has already taken medication and then give them the same medication again, which could cause further harm. So, and if our job as EMTs and paramedics is to do no harm, then, help us in helping your loved one. Also, when it comes to lifting, well, assisting in lifting, I know everybody wants to help, everybody wants to be, the He-Man, and so forth. That's fine, that's beautiful. We love that. However, you still have to follow our instructions, because there are certain techniques and ways that we lift so that we don't injure ourselves, injure you, and cause further harm to the patient. Because again, and I reiterate, our job is to do no harm. And when we don't do all of that beautifulness, and we have the patient in the ambulance, yes, we're on scene. Yes, you may see us sitting there in the ambulance, but we're in the ambulance doing stuff. We are triaging, we are assessing, we are getting information, we are starting treatment, we are communicating with the hospital and also with our medical director, who then in turn say, hey, this is what I want to be done, or take this patient this place, and so forth. So those things you have to be very mindful of, even though we are there, and you may see us sitting there, and you may think that we're not doing anything. We are in the back of the unit assessing and doing all the things that needs to be done before we pull off. And as we pull off from that scene and we're heading towards the receiving facility, for motorists and even for like family members, please don't tailgate the ambulance. We stop frequently and we also go at high speed, so don't try to race us. Please don't try to race us. Because 9 times out of 10, we will catch you up and we will pass you, and then you just have to pull over and and allow us to pass you. And also, by you doing that, you can also cause another accident, which we don't want, because now we're taking your lift to the hospital. You get into an accident trying to beat it to the hospital, which then in turn causes us to have to now stop and quickly triage you and then call for a backup unit, which is then going to delay care for your loved one, because we can't just grab and go and then leave you because you would have been at fault for the accident. So we have to be mindful of those things. Next.
So as Justin mentioned, offer assistance appropriately, meaning once we give you instructions, follow that instructions because we are trained. This is the field that we have obtained extensive training in. So we will know what you can do safely in order to help us do our jobs properly. The next thing is providing information. Do not withhold information from us as it could cause a gap in the care that you can receive. Some people trust physicians more than they seem to trust EMS, but we are the bridgeway from you and your emergency to you getting to the health care facility. So it's best that you give us all of the information, all of the medications you may have taken, the exact story of how you ended up in the situation you're in. It is imperative that you provide accurate information and details on everything going on about your situation so that we can offer the best patient care possible.
Okay, so the next one that we do want to talk about is creating a safe environment for EMS. This is very important to us. Safety is our #1 priority. Sometimes I know that when emergencies happen, we all tend to gather around, but sometimes we may be asked to step back from us because we need a clear pathway. We don't, sometimes we walk through crowds. If we're not safe, we're not gonna proceed. Because at the end of the day, the crew is first and then we tend to our patients. We can't do this in the capacity if we feel as though we're not safe, we don't have an exit, or too many things is going on at once. So we just ask a lot of times for us to provide safe and effective care for our patients, that you just provide that safe environment for us. Another one that we want to talk about is cooperation during transport. I know a lot of times that people may be embarrassed to tell us certain things, or they may withhold certain information from us. But like Chetlynn said earlier, we need to know certain information. If we ask you a question like, maybe do you take drugs or alcohol? It's not a judgmental question for you. Sometimes some of our interventions or some of our pain management medications may be similar and they may not interact well with drugs and alcohol. So sometimes if you do take it and you're honest with us, we're able to alter our treatment plan to be able to best treat you without causing any further harm to that patient, because at the end of the day, our patient safety is our priority. In the back of the ambulance is our safe space. What you tell us in the back of the ambulance only goes beyond the ambulance to a physician or a nurse that needs to know this information to continue care with you. It does not go outside. It does not go to your family members without your consent, because it's a violation of your privacy, and we do value everyone's privacy very much. All right.
What to expect when engaging with on-site emergency room. So there are several things you can expect once you arrive to the ER. The first two things would be triage and registration. So triage begins once EMS brings you into the ER. They would then give handover to either a registered nurse or to the ER physician. In this handover, they will be explaining the background story of what happened, any medications that you may have received during EMS interaction, your status during transport and prior to transport. So that is basically triage. And then there would be registration, where the hospital staff would come to you or your relative and register you so that you can now receive your thorough medical evaluation and assessment. It goes on to treatment, and then you're discharged.
Wow, the big one, the common misconceptions of EMS. Okay.
A common misconception of EMS is that EMS is just a transportation service. It is not. The ambulance is not a taxi. There is actual critical medical care that takes place in an ambulance, and even it begins as soon as the crew arrives to you or your relative. So as we have been reiterating all night, we are not just parked up with the lights and sirens on doing nothing. We are offering medical care to you or your relative. A next misconception would be that all EMS workers are solely ambulance drivers,
Yes.
and that is not a compliment either. We have different levels of training. Being an ambulance driver is an add-on certification to our already level of pre-hospital care. So we have EMTs that are also EVOs. We have paramedics that are also EVOs, which is an emergency vehicle operator. At Doctors Hospital, all of our EMS personnel, the EVO course is just an add-on to their current level of pre-hospital care. The next misconception would be EMS personnel replaces the need for seeing your primary care physician or visiting the hospital. We are not able to tell you if you have an ear infection. Our job, we are trained to assess the situation, assess the severity of the situation, and stabilize you so that you can receive further medical care at a healthcare facility. We don't have a CT scan on an ambulance. We don't have an X-ray machine. So we won't be able to tell you if your leg is broken. So it's best that you call us with the intention of going to receive further medical care at a healthcare facility.
All right, another one that we want to talk about is all EMS personnel have the same level of training. As Chetlynn stated earlier, we do not. We have EMTs, we have AEMTs, and we have paramedics. We have very different scopes of practices. So today, let's say an ambulance came for you today, a paramedic picked you up and they did certain levels of care for you. And weeks later, another ambulance comes for you for their EMT basic. I understand that everyone doesn't realize that we are different entities, so they can tend to get frustrated to say, well, they did it for me a few weeks ago, why can't you do it now? We all have our different scopes of practice and we are to function within those scopes of practice. So sometimes the care will not always be identical to what was done for you prior to. Another one that we definitely need to touch on is lights and sirens on an ambulance means to stop and pull over. So with this one, we have a lot of times where we're in the ambulance and we're doing active patient care. Usually when we're going lights and sirens, we're either going to an emergency or we're coming from an emergency trying to get to our definitive care, which is usually the ER or the hospital. A lot of people tend to wait until we're literally beneath their car's bumper to stop. We need you to pull over, and it's best to do it when you see us in the distance and not when we're underneath you, because people tend to panic and they love to try to drive across the red light, but that's not very safe. Whenever you try to go across the red light, please yield and look before you go across the red light so that we don't cause another accident. And then that's another emergency going on while we have one going on as well. If you have to pull over on the sidewalk, trying to pull over prior to the unit, becoming close to your car gives you more room to be able to pull over on a flat surface, because we do know that a lot of cars are smaller, so it's harder for them to pull over onto the higher sidewalks, and a lot of our roads are very slim. So there's not much room to move over, but that's why if you hear the sirens, just kind of look around your environment and see if you can see the ambulance, and if you can't, just try to pull over prior to us. Again, like we said earlier, the ambulance moves at a very high speed. So even if you're like way ahead of us, at some point we're going to catch you up and we're going to outrun you. Please do not race the ambulance because you will not win. Okay. There you go, Justin.
Oh, okay. Another one is payment is required upon EMS crew's arrival to your location or before you arrive at the hospital. Now, for us as EMS professionals, our primary goal, EMT's primary goal is to arrive on scene, assess you, and take you to the hospital. We, as EMTs, do not handle direct payment. That happens at the hospital. Okay, our primary goal is to arrive on scene, assess you, find out where the receiving facility is best suited for your condition, and then we take you there. When it comes to payment, that is not us. Our primary focus is patient care. That's what we do. That's what we come in the field for. That's our job. We care for you. Another one is EMS must provide patient care regardless of safety concern to the crew. I will tell you, if the scene is unsafe, I am not entering. Because if I am there to provide care for you, and if I get injured, how can I provide that care for you? I can't, because now I'm a patient. And then also, if it is my partner who is now injured or in fear of being injured, I have to now make the decision that, hey, we cannot go in as a unit, and I am not a one-man band. If we're on the ambulance as a team, we have to proceed as a team. If one of us feels unsafe, we have to identify the threat, try to neutralize it, and then proceed into the scene so that we can be safe, so that we can stop patient care and continue that from when we make contact with you until we get you to the hospital.
Then we can ask for the-
Hold on.
Okay.
Go make a
Just
point.
to touch back on this point about the payment thing, please do not hesitate to call the ambulance, believing that, oh, doctor's hospital is very expensive, we can't call that ambulance, let's call the other ambulance. If you're having a medical emergency, our priority as EMTs and paramedics is for your better safety. So if you need to call the ambulance and you call doctor's hospital ambulance, we're not gonna show up on scene and ask you, well, where's the money before doing our patient care. So you can call us. We don't only transfer the doctor's hospital, we also do transfer patients to the public hospital as well. I know that's another misconception, believing that if you go by doctor's hospital ambulance, you must go to doctor's hospital, but you can be transferred to PMH or doctor's hospital. We typically ask our patients which hospital would they be going to before just transferring them somewhere. All right.
Well, that's the end of our. Thank
You ready
you
for
for
more?
listening. I guess now we'll open up the floor for any questions.
That we will. All right, so I'll read out the question. Sorry, I'll read out the questions for you. But first, before we get to the questions, I do want to remind our audience that, again, if you're watching on YouTube, you can drop your questions in the comment box. If you're watching on Zoom, then you can add them to the Q&A section. But I want to thank our team for giving this presentation this evening. There's a couple of things that I know just from personal experience. Literally, just driving the other day, I actually saw a vehicle try to cross the red light, not to get from in front of the EMS, but actually to cross the intersection before the EMS crossed the intersection. And so again, a reminder to those as you're watching, I know we all feel as though what we have to do is so important, but you know, we do have a lot of great, highly trained, highly skilled individuals who are working in our EMS teams, and their goal is to get whomever they're treating in that moment to, you know, the best care and to the best care as quickly as possible. And again, you know, even in terms of the safety of the scene, I've done the basic life support training and things like that. And even in that space, when it's just that, you know, things like, you know, if you're choking, that sort of thing, the first thing that they will tell you, even in that space, is assess the scene. So even if you as an individual, if you had that sort of training, imagine how much more so when you're talking about EMS who may be coming to a vehicular accident, you know, an act of violence, things like that. There is that need to assess the scene before diving into giving care. And again, the idea that that's not to mitigate or to make what's happening in that moment any less serious, but you know, their safety is also a part of their ability to give you care. So we'll open the floor for questions. We do have one that's in the chat now. And the first one is, what are some of the interventions that EMTs can provide versus a paramedic? So just kind of looking at the difference between the two.
So, okay. On an international standard, an EMT would have just basic interventions, like if someone is experiencing shortness of breath, we can give oxygen. We have a certain amount of medications that we can assist with, like nitroglycerin, that's for someone that is a cardiac patient. Other things like just basic life support, CPR, bandaging wounds, bleeding control, splinting, fractured or dislocations, you know. That's just basic interventions, as opposed to a paramedic who has more of a wider advanced scope.
Okay. So from a paramedic standpoint, there's a lot of things that we can do versus an EMT, such as intubation. We can do endotracheal intubations that they do in the ER. We can have IV access and IO, which is intraosseous, where sometimes we have to drill needles into the bone in order to give life-saving medications at times. We can give a wide variety of drugs. Sometimes we can perform certain skills without having to contact our medical control directly. So let's say we have a patient who is having an asthma attack. That's something that I'm trained to do, and that's something that I went to school and I learned that. So I'm able to administer those drugs independently at times. So what's the other question that you have?
So very informative presentation. Appreciate the level of information that was presented. Do you guys determine if the patient has any advanced directives before providing advanced care?
Yes.
And then a secondary question, are you guys trained to care for acute mental illnesses?
Okay, so for that first question about the advanced directives, usually if we have a patient, let's say we have a patient in cardiac arrest, when we get to the scene, that's a part of our primary scene assessment to know, do they have any advanced directive? Do they have a DNR, which means do not resuscitate? Is it valid? Is it in date? And is it signed by a medical physician before we carry out our full assessment and treatment plans? However, we have to start treatment until these advanced directives or DNRs are presented to us so that we can know. Delaying care to find out if it's there or not can actually be harmful to the patient, because let's say it's not present, that means we technically just allow the patient to delay care on that patient looking for this DNR piece of paper. What was the other question? Sorry.
The other question was mental illnesses. Are you trained to care for acute mental illnesses?
Could you rephrase the question a bit? I'm not.
So they're asking that if the EMS team is trained to provide medical care on site for people who have advanced instances of mental illness.
So when we deal with people with mental illness, sometimes we can encounter very violent people, and if we're unsure about the patient, sometimes we do need police assistance, just in case the patient does become violent to the team or very agitated, or they may become very excited around the team. So we do provide supportive care, but there is not a wide variety of things that we are trained to do for medical emergencies. Most of it is just supportive care and being able to handle it. Sometimes if we have to give medication to calm that patient down, then we would have to do interventions such as that.
Okay, so just checking our YouTube comment section as well. Okay, so this is a good one. What can the public do to help a seizing patient until an ambulance arrives?
Big question.
For seizing patients, you would want to turn them on the side. Move everything around them and do not put anything in their mouth. If they're having this, if they're actively seizing, turn them on the side, remove everything from around them. If they have anything that is restrictive on them, try to remove it as best as possible. And honestly, just let them have the seizure, because if you try to stop them from having the seizure, you're gonna either cause harm to them or you're gonna cause harm to yourself, because there's nothing that you can do for that patient who's seizing at that moment aside from just
Protect
them.
them.
Yeah, just protect them and keep them safe.
Okay. Another one from YouTube. What are the hallmarks of a good EMT?
Chetlynn.
Yeah,
Great
you.
question.
Is that the superstar?
The hallmarks of a good EMT, I would say someone that is patient enough to deal with people, because this is an emergency centered career. You have to be patient with others. What you deem as an emergency may be completely different than what someone else deems as an emergency. So you have to be patient and empathetic towards people. You also have to be detail oriented. You mustn't be someone that reverts to having tunnel vision, because the field is so broad. There could be so many things going on with patients. You just have to remember your training and focus on what you can do for this patient and making sure that you get them to definitive care and offering them the best patient care you could possible.
Okay. I mean, I would say that wearing glasses, because obviously that seems to be a part and parcel with this particular team. All right. Another question from YouTube. What makes doctors, hospitals, EMTs different from other institutions?
Go
I
ahead.
guess this is my question. Okay, so as an EMT, I got my certification with the NREMT.
Mm-hmm.
So as mentioned before, on an international standard, they only offer basic life support. But at Doctors Hospital, we have been afforded the opportunity to obtain other certifications like IV insertion. We also work closely under medical control so that we can administer certain medications or give fluids to patients that require it during transport. So I guess that is mainly what separates doctors, EMTs from other institutions. We are allowed to do advanced care. We act as advanced EMTs, even though our certification is EMT basic, but that is only because we have obtained the additional add-on certifications and our medical direction, our medical control gives us permission to do so.
Okay. I know this might have been answered in the presentation, but in case this person missed that, and if you can add to it, the question is, what can individuals do to prepare for the EMS crew's arrival to the scene?
What you can do to help us and prepare is to either put up any pets that you may have, like dogs, any other exotic pets that you may also have. And this is
I'm sorry.
different pets nowadays. Like,
That's true. Clearly, you have a history with dogs too, though. You're heavy on the dogs.
Again, dogs have teeth, and we're experienced, they will bite us. Also, if you can, clear the driveway of all vehicles so we can have a direct line of direct access from our bus straight to the patient. Also, if you have any big furnitures that are able to move, you could kind of, move them out the way so that we can have, again, direct access. Oh, if the patient is taking like a lot of medication, if you can get that so that when we arrive, we don't have to either delay care delay transportation to definitive care by you looking for the medications, because all of that is vital information that we need, and that has to be taken into consideration when we are coming up with a treatment plan with our medical team, with the medical director.
Okay.
So those are just some of the little things that you can do to prepare before we arrive.
Okay. So another member of the audience asked, how can we improve the presence of EMS on the less populated islands?
Sorry, say it again.
How can we improve the presence of EMS on the less populated islands of the Bahamas?
Oh, wow. You're gonna take a whack at it?
No, I'm not. I feel like, let me try.
I'm not.
So I feel as though that question is kind of geared more toward the Ministry of Health, since that they deal with EMS and healthcare on a wide basis. We can't do it, like we work for EMS and we're able to provide this level of care, but we can't make EMS what it is by ourselves. That's where government entities come in and they're able to assist. They can fund more clinics. They can try to fund more smaller clinics, because I know funding a hospital is very large and that's a lot of money. It's not just the easiest thing to do in the world, but that's kind of where the government has to step in to help us to be able to do that. We can't do that on our own. We're the staffing that is able to provide the care, but we need someone to provide the funding in order for this to happen.
Okay. Someone added, I think, to the question earlier, saying that you should let the dispatcher know if the size of the patient, if it's an upstairs home, or if the person is, so if there's an upstairs entry rate to the home, and if the person is upstairs in the home, because all of those things then add to right.
Very important.
Okay. So that's good to add on to that. How do you guys handle dangerous cardiac rhythms?
This is my section. So at least at Doctors Hospital, because the EMTs have some level of advanced skills, we are almost able to handle it in similar situations. But let's say we're on an international level and we're dealing with EMTs, and then we have paramedics. Paramedics are able to give cardiac drugs, which is a part of ACLS, advanced life support. So with pediatrics and adults, we're able to give medications to convert certain rhythms after we're able to identify and treat these rhythms. We also have electrical therapy for patients who are really unstable and they're unable, like let's say we give a medication and it has no effect. because the patient has deteriorated so far, we're able to do electrical therapy such as defibrillation, where we do usually on cardiac arrest for shockable dangerous rhythms. And then for patients who have a pulse, we're able to do something called synchronized cardioversion, trying to attempt to bring the heart back to its normal rhythm before it turns fatal.
Okay. Another member of the Zoom audience, excellent and very informative presentation. They have a very interesting question. I think we have one or two more and then we'll wrap. How do you manage a maternal collapsed mother who is unresponsive, but there's a fetal heart rate?
Okay, so just like how we would manage any other patient, what was the question? Sorry, Tuba, you skipped the Tuba.
Sorry. So how would you manage a maternal patient with a who's unresponsive, but there's a fetal heart rate?
Manage any other patient, we assess our scene. If the patient is down and known to be in cardiac arrest, we would start CPR specialized to those population of patients. We just kind of, sometimes how we go in the middle of the chest on pregnant people, we may have to go higher on these patients. So we kind of manage them just as we would manage other
Anyone else?
cardiac arrest, but
Mhm.
it's just specialized to maternal mothers that are pregnant.
Okay. So our two final questions.
Okay.
And I guess everybody could kind of take this one. What is the most challenging part of being an EMT?
Okay, so I can answer from my standpoint. The most challenging part about me being a paramedic sometimes is that people believe that we are desensitized to certain situations. So they believe that we just handle things, move on, and it's like nothing to us. To me, honestly, sometimes some situations are very hard on us, and afterward, it can cause long-term mental effects on us as well.
Mm.
I don't just go on scene, deal with a patient, drop them off, and be like, okay, next patient, let's move on. I think about some of these patients in a long capacity. Sometimes some calls are very traumatic, especially calls involving pediatrics and children. They are very traumatic on us and can cause long-term effects on us. That's one of my hardest parts.
So I think I'd say the same thing. I would definitely say that the job can sometimes be emotionally taxing because we see different emergencies, different situations, and every situation is different. Like the nature of the situation, the background of the situation, it all plays a part in how we feel afterwards, after the call, during the call. But I mean, yeah, I'd say that's the hardest part, the high stress, high emotions, yeah.
Not to sound like a broken siren, but I do piggyback onto them as well. I think that is one of the most hardest part of being an EMT, because when we go there and we encounter people, we encounter them in their, sometimes in their, not in the best shape. So when we have to deal with them, we sometimes take on what they're going through at the particular moment, and we sympathize, and it's hard for, sometimes it is very hard for us to take ourselves away from the emotions that is happening with that patient and their loved ones and so on. And that in the long run, like what Chetlynn said, it can be very stressful, it can be very toxic, and the job itself, it requires a certain level of, I guess, if I could use the word oomph and chutzpah, like it just takes a level of that, like you have to know how to be present and not present at the same time. You have to know how to relate and not relate at the same time, because if you allow yourself to be consumed by what's happening, you can develop tunnel vision, which is very bad, because you will either miss something or you would start to feel that everything that is going on is either that this is your relative that's going on, and you may forget that you are an EMT, you may forget that you are a paramedic, and you may step into the realm of, this is my relative, I have to now act as someone on the street who has no training.
Mm-hmm.
So you have to be calm, you have to stay in the moment and remember that you are there to help and not to hinder.
Can I make one more point?
Sure.
About that? So also with that, although people think sometimes we can appear on scene and we may not seem, I guess, emotional to it, but I guess if we appear very emotional, it's going to cause either the family members or the bystanders to panic. They're going to lose trust in us, and then it's going to cause them to panic. When they start panicking and they don't trust us as providers, they tend to hover over their family members, or they tend to hold them close, which also delays cares on our aspect. Just because we don't appear very I guess, scared in the situation at the time. Afterward, it can have a long-term effect on us. At the end of the day, we try to be a provider first, and then afterward, if we need to go cry about it or talk about it, we will go and debrief about it later. But we can't do that on scene because our patient is our number one priority at the end of the day.
Okay. A follow-up to that question, how do you de-stress from what seems to be such a stressful job?
Okay, I think that question is very
Personal?
No. Everyone has their own way how they de-stress about it. Some people maybe have hobbies and sports on the side. Maybe some people don't have the healthiest habits, but everyone de-stresses in a different way. So that's kind of not really a straightforward question. It kind of depends on the individual and how they decide to deal with the situation in the moment, honestly.
Okay. Sure.
Now, backing to what Rianna said, I know our job is stressful, and when it comes to de-stressing, like she said, it is personal. It is personal for each individual, but the most common thing that I could say, if for an EMT, if you have experienced something that is stressful, if you went on a call and it was very emotional or stressful, talk to your partner. If you can't talk to your partner, talk to someone who you trust, because you have to debrief. You have to take that off of you, and you have to like seek help. And if they cannot help you, then I would advise get professional help.
Okay. And the last question, how can someone pursue a career in being an EMT? Where do they get started?
Well, first you'll have to find an EMT school, an accredited EMT school. Yes, one that would train you so that you would be able to take the NREMT examination. Once you've obtained the NREMT certification, then you should be able to apply for your HPC license that is in the Bahamas, so that you may be able to work in the EMS system.
Keep going.
That's basically how you become an EMT. Doctors Hospital has a program at the Doctors Hospital Institute of Learning. They have an EMT program. I took the EMT course at the Doctors Hospital Institution of Learning. The course was a fast-paced course, but once we were done, we were able to sit in our EMT certification, and I was also able to obtain my HPC, and now I am an EMT here at Doctors Hospital.
Awesome. And again, thank you to our presenters tonight, Mr. Justin Hepburn, Ms. Chetlynn Thomas, and Ms. Rianna Sweeting. And for our audience watching at home, a reminder that if you are in need of an emergency medicine services team, emergency medical services, you can call Doctors Hospital at 302-4747. That's the direct number to our ambulance. If you are unsure if you need emergency care and perhaps need an urgent care facility, you can reach our urgent care at Doctors Hospital West at 302-4710, and in Freeport, our urgent care center at Freeport Medical Center at 350-4490. Also for our audience, we have some specials going on during the month of May as a part of Mother's Day. So our locations in Freeport are running a Mother's Day special on annual physicals. So you have annual physicals available at $175, which includes the mother and one child. And there's $40 for every additional child beyond the first. As a bonus, you get 3 months complimentary for our LAMP program. And if you're unable to get an appointment during the month of May, if you book by May 31st, you'll be able to access that appointment up until July 15th. And for the child's visit, they'll be seen by a family medicine physician. And if you want more information about that program, you can call 350-4490 at the Freeport Medical Center, or you can email grandbahama@doctorshosp.com. For our New Providence folks, there is a Day for Mom, a Day of Love special by our rehab department. So we are offering pregnancy and prenatal massages, single sessions at $80 for a 60-minute session, or a 5-session bundle at $325. Postpartum massages, so single sessions are $80, 5-session bundle, again at $325. We have the Mommy and Me massage, and that's for anyone who is postpartum from 3 months to 1 year. 60-minute session is $120, and the 5-session bundle at $500. We have a Mommy and Me workout, which is again 3 months to 1 year postpartum, $120 a month for 1 session per week. And postpartum pelvic floor exercises at $75 per session. If you are interested in that particular special, you can reach out to our rehab team at 302-4636. And that is a mouthful and a half. So thank you very much to our EMT team. This is a great presentation. I hope that our audience at home, you loved it. I saw a lot of good comments. We got a lot of really good questions, really great answers from our team. As always, we thank you for watching, and we invite you to join us back here next month for another edition of the Doctors Hospital Distinguished Lecture Series.